We're back and we're glad to have you join us again. And as always, here on this podcast, we talk about everything as it pertains to sexual and reproductive health. We look at the physical aspect of things. We look at the psychological aspect of things. Then we look at disorders as it pertains to um, sex and reproduction. Anything. We talk about laws, policies, interactions, even relationships as it pertains to sexual and reproductive health. And today will not be an exception. Today we have a very exciting topic for you, and I hope that as you're joining us, that you're already subscribed to the channel. Please, if you're not, please do well to click the subscribe button and to like this video and share it to other people who do well to benefit from the wealth of knowledge that can be found in this channel. And also go through all our videos. We have videos across different aspects of sexual and reproductive health. Surely there will always be something for you. Is it in pregnancy? Is it in STI? Is it as it pertains to consent? Are we talking about sexual health rights and laws as it pertains to it? Is it kink and fetishes? Whatever it is, surely there will always be something for you. And for today, we're bringing something that oftentimes is overlooked, right? A whole lot of people do not know this. We're talking about chemical pregnancy today. We want to look at chemical pregnancy today. And most times, when I mention chemical pregnancy or somebody hears chemical, they're like, what kind of pregnancy is that? Is it a sub form of pregnancy? People ask different questions. So today we're here to know what it actually is. So please strap in. Like I said, do well to ensure that you're following us. Follow us across all social media platforms. Facebook, YouTube, Instagram, TikTok. We'll be glad to interact with you. And if you go on our YouTube description, you see the link to our WhatsApp group where you can join and interact with us. And we'll be glad to hear from you. So let's talk about chemical pregnancy. Chemical pregnancy is just simply a loss pregnancy loss that happens before the fifth week. So if you get pregnant, if that pregnancy is lost before the fifth week, that kind of pregnancy is then a chemical pregnancy. Right. So what usually happens as a whole is that such a person, such woman will test positive to pregnancy, but a few weeks later on, maybe redoing the pregnancy test or maybe by virtue of observation of herself, should see a negative result. Now, the thing is that most people, for some people, they don't even know they have this pregnancy because it happens too fast. The baby comes in, they conceive and then lose the baby so fast they don't even know that pregnancy has occurred. Then it's also important for you to know that. Now, when we're talking about chemical pregnancy, like I said, it's also called biochemical pregnancy. It's a very early miscarriage that I said happened within the first 5 weeks of pregnancy. So basically, before a pregnancy can be seen on ultrasound, if such a pregnancy is lost, that is a form of chemical pregnancy. So what happens is that the embryo forms, so the male and the female germ cells meet, they get together, form a zygote, and starts developing and is implanted, and the embryo starts to form because it's implanted in the uterine lining. But then it stops. What happens is that this happens so unlike unlike other forms of miscarriages that so this one happens so early that the person that is affected oftentimes does not even know that she was pregnant, right? So more oftentimes it may feel devastating because it's still a pregnancy loss. Conception had actually happened. So the emotional environment around it, you still have that emotional feeling of devastation, the feeling of grief and of loss, right? Especially for people who have been consistently trying to conceive that the TTC parent. They feel this huge weight of loss. And I think one of the things that they concern themselves about is the fact that it might become recurring. But the truth is that people who have had one chemical pregnancy can still go on over the years to have babies, that they carry pregnancy to term and have their babies. So it's possible that you have this and you still go on to have a successful pregnancy or successful pregnancies, right? Because it's not just one as much as you would want to. Now, the name chemical oftentimes we like it's insensitive, but no, it's not insensitive. it's possible because of the hormone that gives a positive result when tested. I talked about it where you test indication. So why it is being called a chemical pregnancy is that the only indication to know that this pregnancy has occurred is only because of the hormone. The human chorionic gonadotrophic hormone, which happens during the first 5 weeks that the embryo has implanted. So it gives a positive test result because you cannot even see the developing embryo in an ultrasound. So the only thing you have to know that pregnancy has occurred is the hormone. So what happens is that in clinical pregnancy, chemical pregnancy is the early miscarriage, but in clinical pregnancy, which is like the actual pregnancy, the HCG, that's the human chorionic gonadotrophic hormone level, rise steadily, right? So what happens is that, but in chemical pregnancy, it rises and the test strip can capture it, but then it vanishes away because the pregnancy is lost. And yes, people wonder, yes, chemical pregnancy is a real pregnancy. Yes, it is a real pregnancy. It's just that it's different from a clinical, it's just different from a clinical pregnancy. So that is how it is. That's just what differentiates it. Now we're looking at the fact that about 80% of miscarriages happen early. That's just what some medical findings have been able to show us that about 80% of pregnancies that will end in miscarriages happen very early, right? So about 25 of all pregnancies will end in the first 20 weeks. So it is hard to know how common it is. Remember that I said that chemical pregnancy happens so oftentimes the pregnant woman may not even know that she's pregnant. So what are the symptoms? The symptoms happen when most times when your period comes a week later than usual. So maybe you're expecting your period this week, but it decided to show up next week. That could be appointed to a chemical pregnancy. Maybe you were pregnant and that delayed the period, but then you lose the pregnancy and finally feel and finish the period. Now, a positive pregnancy test, but then you see your period. So, like I said, you're pregnant, but after that, you know, you're pregnant and your period happens. A positive pregnancy test, then a negative test result weeks later. A heavier than normal menstrual flow, oftentimes with more intense menstrual cramp. So it's not often every time that it is menorrhea. It could be chemical pregnancy. Or sometimes you have, maybe you're using a test strip, you found a positive, you're positive in your pregnancy test, but you do not notice the usual signs and symptoms of a pregnancy. That could be a pointer to a chemical pregnancy. Now, people often wonder what it looks like, the bleeding, how does it differentiate from period bleeding? Oftentimes it may feel normal. Oftentimes the bleeding from chemical pregnancy may feel normal. Sometimes it's heavier than usual, leading to more intense cramps. So that is what you really need to look at. Very heavy bleeding, intense cramps, and blood clot. It's quite essential. You look at that. How long does it take to miscarry a chemical pregnancy? I've said it within the first 5 weeks. Within the first 5 weeks, you can miscarry a chemical pregnancy. So sometimes that's how it often happens. But sometimes the issue is that the embryo may stop developing. Sorry about that. So the embryo may stop developing, but then your body, it may take longer for your body to realize there's no pregnancy to expel the product of, of conception. Now, what is the cause? I think that's the core thing. People ask, what really leads to this? What really results in chemical pregnancy? Now, what happens is that we do not know what stops the embryo from developing, right? We can't say exactly. Medical science can't say exactly what stops the embryo from developing. But if we look at what happens is that, like I said, fertilization occurs, the eggs implant, and HCG is now being produced. The hormone is now being produced, right? Human chorionic gonadotropin is now being produced, thereby giving that positive pregnancy test. But then the embryo stops developing. right? So it shows up because even after the embryo stops developing, it takes a while for the HCG to, dwindle. So it may still show up as if you're pregnant when the embryo is not developing. So that's what happens. So we do not know exactly what causes the embryo to stop developing, but there's been some genetic implication. Maybe when there's a problem with the genetic makeup, right? And sometimes maybe the embryo doesn't fully implant well in the uterine lining. So that can happen. Now, the people that are at risk of having chemical pregnancy are people who are trying to conceive through in vitro fertilization, that's IVF. If you're trying to conceive through IVF, you're more likely to experience this. Now, people 35 years and older, those ladies 25 years and older, people that have irregularly shaped uterus, I talked about the fact that the embryo is not implanting like it should. If you have certain hormones in your body that are too high or too low, this could be a risk factor. If you currently living with sexually transmitted infections, any form of it, or you have a thyroid disorder, diabetes, or polycystic ovarian syndrome, that's PCOS, you could be at risk of this. So about PCOS, we have teachings, we have a session on PCOS. So do well to check our videos. You know what PCOS means, and you know if you have risk. So don't forget that PCOS predisposes you to chemical pregnancy. So to help diagnose chemical pregnancy, there is a need for a pregnancy test. So there will be a blood test to show you're not pregnant. Then there will be a test to measure the HCG level in your blood, and also an ultrasound, which will now show that there is no fetus developing. So for you to take care to manage and to treat chemical pregnancy, there are no treatments, but what you need to know is that even when you suffer chemical pregnancy, you can still go on to have healthy pregnancies as much as you want. So it is essential. But it's also essential that as part of your treatment plan, there's nothing that could be done. But as part of your treatment plan, it's also very, very essential that you process your loss. Now, this is a part that has oftentimes been overlooked. People's emotional feeling oftentimes are not being taken into consideration when it comes to chemical pregnancy. Oftentimes is overlooked. Take out time to process how you feel. Take out time to process your feeling. It's a feeling of loss, a feeling of grief. It's essential that you go see a therapist, you get your support system around, talk to people that care about you, be around people that support you, and know that always remember that having experienced chemical pregnancy does not mean you're infertile, does not mean that you can't go on to have healthy pregnancies. Yes, you can go on to have multiple healthy pregnancies. So today we're talking about chemical pregnancy, and I'm sure that you've been learning a whole lot thus far. So if you're not subscribed to this channel, please do well to subscribe, like our videos, and share so that others will also learn. You can follow us on YouTube, which I know you already subscribed, on Instagram, on Facebook, and even on TikTok, where we share as pertains to sexual and reproductive health. And check our YouTube description. You see a link to our WhatsApp group. Please do well to join us. So today, chemical pregnancy was our topic of discussion. We looked at the people that are most likely to be affected, people trying to conceive via IVF, people who are 35 years and older, people who may be living with STD, who have thyroid disorders, living with polycystic ovarian syndrome. And like we said, it's essential for you to know that the cause of chemical pregnancy is not yet known, but genetic issues has been implicated. So the issues in the DNA of the developing embryo, it may lead to an early abortion, which is simply what chemical pregnancy is, a miscarriage before the fifth week of pregnancy. So thank you so much for joining us today. It was a nice time being with you and learning with you. Whenever you're watching this, please do well to drop your comment if you have any question. Drop it in the comment section. I will be glad to answer your question. My name is Nosa Kwawo Akpan. I'm your host on the Intimate Matters podcast. And until I come your way next time, please do well to know that your intimate matters, your intimacy matters. That's why we are the Intimate Matters podcast. And we're here to share with you things that concern your sexual and reproductive health. Please stay safe out there. Practice self-sex. Bye for now.